Welcome to our COVID support webinar for the safe use of places of worship. We appreciate that there is a lot of uncertainty and worry at the moment across a number of business sectors. So our focus during the webinar here today is to offer you support and guidance on what is legally required of you, looking at your COVID-19 workplace risk assessment, outbreak management, and to provide you with information relating to testing sites and vaccinations. We have some pre-prepared questions and answers for you here today at the end, but please do feel free to contact us after viewing this webinar if you have any further questions to ask of us. We will also be providing you with an FAQ document, a link to this presentation, and our email address to keep to hand. Now, which businesses are now allowed to open under Step 4 of the government roadmap? All remaining closed and/or restricted businesses are now permitted to open or fully open their premises, including nightclubs, hostess and sexual entertainment venues, and shisha bars. Although COVID is with us to stay and the infection rates are continuing to increase, government confirmed that at Step 4, most legal restrictions have now been lifted. The removal of the following restrictions applicable to places of worship are as follows. There will be no need to implement social distancing measures, which has previously limited capacity to site. Members of the congregation will be permitted to sing, and there is no longer a legal requirement to wear a face covering whilst indoors within the venue. Government have requested and advised that this must be a gradual easing of restrictions, and for people to take a responsible approach to lifting certain control measures within your venue. Your risk assessment will identify which appropriate mitigations are appropriate to adopt, and you will find as we move on that many mitigations will remain as they were. With time, it is expected that you will take fewer precautions to manage the risks of COVID-19. Now, legal requirements and restrictions that remain. There are restrictions and legal duties that do still remain, all of which will assist with the protection of keeping yourself, your staff, volunteers, and others safe. And it will, of course, help to prevent the spread of COVID-19 from others. Self-isolation remains a legal requirement, and your duties under health and safety law to protect workers and others from workplace hazards. This is the same with other workplace hazards, where you are required to risk assess and to implement adequate control measures to manage that risk. There are 6 steps to protect yourself, your staff, volunteers, and your customers during coronavirus. You should undertake a COVID-19 risk assessment. You should provide adequate ventilation. You should clean more often. You should turn people away with COVID-19 symptoms. You should enable people to check into your venue or to leave their contact details. And you should communicate and train well. These 6 priority actions are to make your premises a safer working environment and a safer place for people to visit. Now, what is a risk assessment? Broadly speaking, a risk assessment is a careful examination of what, in your work, could cause harm to people and the ways that you can successfully manage these risks to avoid this harm from occurring. As the responsible person, you must conduct a risk assessment to understand how the virus could be transmitted in your premises. You should think about the way that you conduct your work, how your premises is used, and ways that you can protect yourself and members of the public by identifying factors that could result in transmission of the virus. By identifying these hazards, you can then identify sensible measures to control these risks. An example of a hazard would be touch points such as door handles and taps, cash, and shared objects. These touch points create a risk as the virus could be present on these surfaces. To avoid this risk, touch points should be wiped down frequently and contactless payment should be encouraged. Poorly ventilated space is also a workplace hazard, which we will cover here with you as we move on. Staff and volunteers should be trained on the findings of your risk assessment, and they should be reviewed and amended as required. Please also note that where there are 5 or more employees, you are required legally to document the findings of your risk assessment. To assist with the NHS Test and Trace service, we are urging venues to keep a temporary record of visitors for 21 days in a way that is manageable for your place of worship. We would also encourage you to assist the NHS Test and Trace service with requests for data, if needed, for contact tracing and the investigation of local outbreaks. You should also consider displaying an official NHS QR code poster so that those with the app can check into your venue. The use of the QR code poster is a much more convenient alternative to a physical register, so long as you encourage the congregation to use it. To continue to reduce the risk of spreading COVID-19 when visiting your premises, we request that you continue to incorporate the following measures. By allowing people to continue to distance themselves from others, think about your capacity and a gradual approach to this. Continue to request that those with symptoms do not attend. Ensure that where you have made changes to entrances and queues, that you've considered those customers who are disabled. Ensure that people do not congregate before and after attending the premises to limit exposure to others, and if people do so, that they must remain outdoors where there is ample fresh air. Continue with cashless donations. Continue to use posters and communicate via online means for your on-site procedures and your asks of people. Preventing the use of shared items such as Bibles and floor mats. Quarantine procedures between uses will apply if reusable items are in use, and we encourage you to request that members of the congregation bring their own. Hymn sheets could also be printed and single use or covered with a wipeable film. Essential food and drink to the acts of worship and items such as cups should not be shared. Now, face coverings and PPE. Where you're already using PPE in your work activity to protect against COVID-19 risks, you should continue to do so. Any use of PPE should be determined by a risk assessment in the workplace. Workplaces should not encourage the precautionary use of extra PPE to protect against COVID-19 outside of clinical settings or when responding to a suspected or confirmed case of COVID-19. Unless you're in a situation where the risk of COVID-19 transmission is very high, your risk assessment should reflect the fact that the role of PPE in providing additional protection is extremely limited. However, if your risk assessment does show that PPE is required, then you must provide this PPE free of charge to workers who need it. Any PPE must fit properly. It is no longer a legal requirement for staff, volunteers and customers to wear a face covering at your venue. We are now being asked to take a responsible approach. We strongly advise at this time that you ask members of the congregation to wear a face covering just before they enter and to also wear one as they move around the premises, such as to use the toilet. You need to consider the reasonable adjustments needed for staff and members of the congregation who have disabilities. You also need to consider carefully how this fits with other obligations to workers and the public arising from the law on employment rights, health and safety and equality legislation. Some people are not able to wear face coverings, and the reason for this may not be visible to others. Please be mindful and respectful of such circumstances. Be aware that face coverings may make it harder to communicate with people who rely on lip reading, facial expressions, and clear sound. If your workers do choose to wear a face covering, you should support them in using face coverings safely. This means telling them to do the following. They should wash their hands thoroughly with soap and water for 20 seconds, or use hand sanitizer before putting a face covering on and before and after removing it. When wearing a face covering, workers should avoid touching their face or face covering as they could contaminate them with germs from your hands. Change their face covering if it becomes damp or if they touched it. They should continue to wash their hands regularly, change or wash their face covering daily, and if the material is washable, they should wash in line with the manufacturer's instructions, and if it is not washable, for them to dispose of it carefully into the usual waste stream. Now, hand washing remains a key control measure to help to prevent the spread of the virus. You should ensure that you have designated hand wash basins located in convenient locations within the premises with a supply of hot and cold running water, liquid soap and paper towels for hand drying. Hand sanitising stations should be placed at the entrance, toilets and other areas throughout the premises. You should request that the congregation and visitors use these as they enter. Staff should be actively encouraged to wash their hands as often as possible and for at least a minimum of 20 seconds. Staff should be reminded to wash their hands after taking deliveries and also after handling merchandise and reusable objects. Now, keeping your premises clean. As you will know, COVID is carried in the air through tiny droplets. Larger droplets can land on surfaces that they touch, while smaller droplets called aerosols can stay in the air for at least 5 minutes if there is no ventilation. Therefore, cleaning your premises is a crucial part to achieving compliance and controlling the spread of the virus. You should implement a strict cleaning regime focusing on touch points such as door handles and taps on all hand wash basins. We recommend that you have a designated member of the team who takes sole responsibility for these tasks and that frequency is high, especially during busier periods. You should remember to keep doors and windows open as a key control measure, including for a short while after the congregation has left. You should continue to use your normal cleaning products that you have already been using. However, there is a British Standard product available, referred to as BSEN 14476. That is a recommendation, but is not compulsory. The guidance stipulates that you should carry on with your normal everyday disinfectant and sanitizer. Please also ensure that you have adequate waste provisions for cleaning materials. Now, ventilation. Good ventilation brings fresh or cleaned air into indoor spaces. The more fresh air that is brought inside, the more diluted any airborne viruses will become. In poorly ventilated spaces, residual virus can remain in the air after an infected person has left and increase the risk of COVID-19 spreading. Many of your premises will be quite large in size, but you may have smaller spaces or rooms that are used by others, which are small in nature and less ventilated. You should maximise the supply of fresh air in your premises, and you can do this via the following means. By fully or partially opening windows, air vents and doors. If you use mechanical ventilation, ensuring that your systems are set to maximise fresh air and minimise air recirculation. By maximising the amount of fresh air in your system, draws in or ensuring additional fresh air will help to avoid spreading COVID-19. You should identify any poorly ventilated spaces I've mentioned as part of your risk assessment and take steps to improve fresh air flow within these areas. The priority of your risk assessment is to identify areas of your workplace that are usually occupied and are poorly ventilated. You should prioritise these areas for improvement to reduce the risk of aerosol transmission. HSE provides guidance on how to identify poorly ventilated space. It also explains steps you can take to improve ventilation in these spaces. If you can't improve ventilation within these areas, you should consider whether it's safer to restrict the time spent in these spaces and the number of people that access these spaces or in fact stop using them. Our Trade with Confidence page contains important information regarding the use of CO2 monitors and how CO2 monitors can help you identify poorly ventilated spaces. Please do take a look at the section on our website for more information. However, just for reference, where there is a continuous talking or singing or high levels of physical activity, such as dancing, playing sport or exercising, providing ventilation sufficient to keep CO2 levels below 800 parts per million is recommended. Now, testing and isolation. LFT testing should take place twice weekly. Those who present with symptoms or test positive following an LFT test should isolate and arrange for a PCR test at home. Now, when do my staff or volunteers need to isolate? If they are symptomatic, and this applies to those vaccinated and unvaccinated. If positive via an LFT and whilst waiting for a PCR test, again for the vaccinated and unvaccinated. Where they have received a PCR positive test result, again for the vaccinated and unvaccinated. When in close contact with a positive case. When returning from amber countries, and when returning from red countries, which is currently deemed as quarantine. You do have legal responsibilities to ensure compliance with this and must not encourage nor ask someone to work whilst they are required to self-isolate. You as the employer or responsible person and your employee will be liable for legal action in the form of a fixed penalty notice and/or prosecution for any breaches. Now, there are some proposed changes coming this month in August. The government are yet set to announce these confirmed changes. They will, however, arrive in due course, so please do keep an eye on our Trade with Confidence page and the news for further details. Now, what is an outbreak? An outbreak is a sudden increase in occurrences of a disease within a location through person-to-person contact or from the environment. Now, what should I do and who should I contact? If you become aware of 2 or more positive cases of COVID-19 over a 14-day period within your workplace, you should contact Public Health England on telephone number 0344 225 3560. Press option 0 followed by option 2. You should have a lead point of contact within the organisation to control and manage such incidents. This lead person should immediately identify any close contacts and advise them to self-isolate. You should not wait for the NHS test and trace team to tell you to do so. This prompt action will help to reduce the risk of a workplace outbreak. If the local public health team declares an outbreak, you will be asked to do the following: to record details of staff with symptoms of COVID-19 and to assist with identifying any close contacts. You should therefore ensure that all employment records are up to date. You will be provided with information about the outbreak process, which will help you to do the following: to implement control measures, to assist with communications to staff, and to reinforce prevention messages. Should you fail to get through to the Public Health England team, please do contact our local public health team on the email address provided at the end, where they will be happy to help you. Please contact Environmental Health COVID Business Support for assistance and advice in relation to workplace enhanced cleaning and any additional support that is needed. We'll provide you with the guidance to cleaning the workplace for non-clinical settings where there's a suspected or confirmed outbreak. One important thing to continue to implement during such uncertain times is to continue with designated teams and partnering. This will reduce exposure to others, which will also assist with being able to open during instances of workplace outbreaks. Now, other areas that you must consider. Many of you will have other services on site, such as voluntary food services, children's playgroups, and other support services. Some of you also rent out your spaces for gym classes. Each group will be responsible for their own risk assessment, and you should remember to liaise between one another with regards to site control measures. There are some groups who are at high risk of severe illness from COVID-19. Please see the guidance on who is at high risk and protecting people who are clinically extremely vulnerable for further support. You should give extra consideration to people at high risk and to workers facing mental and physical health difficulties. Those who are clinically extremely vulnerable are no longer advised to shield. Therefore, you should continue to support these workers and your members of the congregation by discussing with them their individual needs and supporting them in taking any additional precautions advised by their clinicians. Consider providing support for workers around mental health and wellbeing, and we will provide you with a link for further advice on this via our FAQ document. Please do remember that as an employer, you have particular responsibilities towards disabled customers, disabled workers, and workers who are new mothers or pregnant. For workers who fall within this category, please carry out an individual risk assessment for their needs. Now, if you are visiting people's homes, please ensure that you are carrying out pre-health checks of all household individuals for symptoms of COVID-19, self-isolation, and to also see if there are any vulnerable household members. There may be requests for face coverings to be worn, and it is still a gradual approach to social distancing, where you should remain extra vigilant when it comes to physical distancing from others. Meetings and training should be held via alternative means still, such as via online platforms, and any work-related travel should ideally be alone, not via car share, or where public transport is used. We would strongly advise at this time for face coverings to be encouraged. Now, COVID compliance grant. Many of you will have seen or have been issued with a COVID compliance sticker by an officer for within the COVID team. The City Council introduced our COVID compliance recognition scheme to acknowledge the good work of businesses across the city and to provide the public with reassurance that these businesses are safe to visit. The City Council has since introduced a COVID compliant grant scheme. This is available to all business sectors, including charities, the voluntary sector, the self-employed, and yourselves to recognise your hard work and to help you with means of operating safely. Funds could be used, for example, hand sanitisers, cleaning supplies, any posters, and even contribution, for example, to ventilation. We've received over 220 applications so far and urge those of you who haven't already applied please do so. There are limited funds available and it is on a first come first served basis. We will provide you with the details as to where to apply via our FAQ document afterwards. Businesses with 5 or less employees are entitled to £500. Those with 6 or more, you will be entitled to £1,000. Once the application has been submitted and accepted by our grants department, an officer from within the COVID compliance team will make contact with you to arrange an appointment to visit you. During this visit, the officer will run through your COVID-19 risk assessment and your control measures. They will offer you support or guidance that is needed. Please do note, should you fail to comply with implementing a suitable and sufficient risk assessment, you will not be issued with the remaining amount of funds. However, revisits will be made to offer support to achieve compliance. You will be issued with a COVID compliance sticker if you haven't already been issued with one, and your business details will be listed on the council website as a COVID secure premises. We also encourage you to display your sticker in a prominent position so that it can be easily identified by members of the congregation. Now, the following few slides show vaccination and testing information, with walk-in vaccination centres noted and test sites for symptomatic and asymptomatic testing. Please do make contact with us should you have any questions on these. Now, we have been asked some questions previously that I'm just going to run through with you now. So, is handshaking now allowed between the congregation? Now, in relation to that, as social distancing has been removed, the guidance still does request that this is a gradual approach. So what we would advise at this time is that you have ample supplies of hand sanitisers for people to use before the likes of such of handshaking to ensure that people have, or at least have, clean hands before they are shaking hands with one another. Do I need to continue to restrict capacity to the premises? As I mentioned earlier, this is a gradual approach and should be taken with caution over the summer months in particular. How do I encourage people to move on after they have attended a service? Now, I appreciate that a lot of you will have large volumes of people attending site, so we would strongly request that you make an announcement before people leave to ask them to not all leave at once, for them to gradually exit the venue, and then for you also to move outside yourselves and kindly ask people to move on. Do I need to close if I have an outbreak within the premises? In relation to that, you will need to, if there is an outbreak confirmed, you will be liaising with the Public Health England team, the local public health team, and ourselves in the COVID business support team. We will come to an agreement and provide you with advice as to whether the workplace does need to close. It all comes down to our confidence, your measures in place, how many people have been affected, and what the best possible means are for you to be able to reopen safely. Will the local authority be taking action, and in what scenario? We do still have powers under the Health and Safety at Work Act, and like I say, for self-isolation, breaches, and where there is an imminent risk to health. Those scenarios are a very last resort. We want to take a very light touch approach. If we do have clear breaches of self-isolation regulations where people are being encouraged to come to the workplace, we will be issuing fixed penalties on those matters, and we'll be doing some joint work with West Midlands Police. In relation to premises where there is an imminent risk to health, this is in extreme circumstances where we have strong evidence that the confidence in management is low, the infection rates are high in the area, and you have insufficient means to prevent the spread of the virus on site. I've heard that you can return to work if self-isolating with daily testing. Is this correct? There is currently a study being undertaken by Public Health England. This, at the moment, is only for large-scale businesses that are part of this pilot scheme, and it involves members, example, who work for Green King pubs, who have been in close contact with a positive case, to carry out an LFT test daily. And if it's negative, they return to work. If it's positive, they have to self-isolate and arrange for a PCR test. That wouldn't be applicable to your business sector at the moment, but please do keep an eye on the news and our Trade with Confidence page to see if that does change over the coming months. Should I continue to use a checklist for everyday COVID-related checks? Yes, we would recommend that at this time. It helps with keeping a check on which areas have been cleaned and what tasks are a priority. It'll help staff members to keep on top of things. And will also, for example, if you keep a cleaning schedule located within your toilets, it allows members of the public, the congregation, to see that checks are underway and those tasks have been completed. Now we've listed here our useful guidance and contacts. So please do follow those email contacts if you need support, particularly around workplace outbreaks and assistance with your COVID-19 risk assessments. We've also included guidance for funerals and weddings, civil partnerships, receptions and celebrations, because the COVID-19 workplace safe guidance still does refer you back to those guidance documents. If, for example, you do have other services available, such as food services or gyms and leisure activities on site, please do look at our COVID-19 Trade with Confidence page. There are other means of guidance documents and also webinars that will be of assistance should those responsible for those groups need help and support. Please do make contact with us. As I mentioned, if you have any questions or concerns, we'll be happy to help you. Thank you for your time and for listening. We wish you all the best for the next stage of the government roadmap. Please remember to be safe and most of all to be kind to one another. Thank you.